afternoon, everybody. This is, my area of expertise. I've been in environmental purchasing for well over 15 years, back in the days when it was buy recycled. That was the big buzzword. So I'm glad I can share with you what Practice Green Health has to offer in terms of buying environmentally preferable products. And we do, by the way, have a number of resources on our website. Whether you're a member or not, they're accessible. So I wanted to make mention of that. I am going to have to leave right after this session to catch an airplane. So I want to open it up that you guys can ask questions at any time throughout this. So please just raise your hand if I wasn't clear on a point or you'd like more elaboration. So don't hesitate to stick your hand up in the air and I'll be happy to stop. So today I really want to just go over and help you to understand that environmentally preferable purchasing is tied into sustainability, and I'm going to demonstrate that throughout this presentation. So if you're looking to implement any kind of sustainability plan, EPP, as we commonly call it, can help you. I also want to address some of the major concerns, and we've already gone over several of them already this morning, so I'm going to go through them fast if they happen to be repeats. And then, as purchasers, or those interested in green purchasing, there's a lot of green claims out there that are really not good. And I mentioned to Beth earlier today, we had a GPO call last week to mention one that was very misleading. So I want to help you to understand what is green or what is greenwashing. I think you already know what Practice Green Health is, but what I did want to tell you is that we do offer tools and resources on our website. We've become a member-based organization, so members are able to get more information online. They're able to access webinars, trainings. We have a Clean Med conference coming up in the spring, and members can apply for awards and be recognized. We also have what's called the Green Guide for Healthcare that was mentioned earlier, and it's a toolkit to help hospitals become sustainable in their building design and their maintenance and operations. And you can find it on the website. It is, as someone mentioned, it is a big document, and some of it's being updated as we speak, but it was the first tool to come out to help healthcare really with building design and to design it sustainably. The Healthcare for Clean Energy Exchange is really targeted to hospitals directly. This is a new thing, and what they're doing with this organization, with this program is doing is it's offering reverse online auctions to help hospital facilities to reduce their energy costs by getting better competitive pricing, and as well to add more alternative energy to their repertoire of energy sources. And then we offer the environmentally preferable purchasing services, and as I've mentioned before, I am currently working with a number of GPOs, including Novation, to help identify what the environmental attributes are on their contracts and to help them be made available to all the member facilities, such as St. Patrick Hospital. Yes, question already?
Already, yes. Is VHA Novation a member of Practice Green Health?
There's a fine line. VHA and UHC are both under Novation, and Novation as a member gets so many hours of expertise and assistance, and if they want to share it with those two organizations, they can, but otherwise I think that they would have to join directly. The federal government actually launched EPP many years ago, about 10 years ago, and it's actually a required mandate that federal agencies buy green products. And it's also a mandate that they buy bio-based as well as recycled content. And so they defined what EPP is. And it's essentially a product or service, because it does include services, that have a lesser or reduced impact than a competing product or service. And when you look at the whole gamut of environmental attributes, there are a lot of them. And sometimes you can only look at one, sometimes you can look at more than one. We're all aware of all of these. We can look at air emissions, toxic chemicals, maybe by switching to green cleaners instead of the alternatives, packaging, compostability, and we also can include food as another area of environmental purchasing. But the point I want to make here today is, why do we want to consider environmental purchasing? I mean, why is it important? Waste really means that the system is being inefficient. Also, the other point is that everything that goes out the back door as waste or emissions came in through the front. So if we're not looking at what comes in the front door at the very beginning, then we're never going to address waste and emissions reduction. So we have to really look at that up front. And purchasers are actually the central standard setting point for every product and service. So if they can change their specifications and include a number of environmental attributes, then especially at the GPO level, then you as a member are not dealing with a lot of packaging. If they've specified that, they may have specified take-backs, and therefore you won't have to deal with it as a waste product and have to figure out, what am I going to do with all this e-waste? So if it's addressed at the GPO or at the purchasing level, and most likely at the GPO level, that can have the most impact to you as a hospital. There are a number of benefits to EPP. It does actually, environmentally preferable purchasing can help reduce costs in certain areas. I mean, there are always products that may cost more, but it can reduce the impact on the environment. If you are buying an environmentally preferable product with less packaging, you're going to reduce your waste disposal costs. There are also costs associated with using toxic chemicals or something with mercury that spills, so there could be occupational health costs involved. And if it's not a mercury-containing product, you're not having to deal with that expense. And you also, if there's toxic chemicals, you don't have the expense of having to deal with the worker safety issues. Using environmentally preferable products is healthier for staff and patients. It's an opportunity to promote yourself as a green facility, and it improves employee satisfaction. I think that was already mentioned here earlier today. So what goes into the total cost? And I've mentioned this earlier that you can't just look at the purchase price of a product. Really, you really want to look at the product disposal. I mean, I know Beth is working hard to try to address how do we deal with this product. But if you could integrate your disposal budgets with your purchasing and see where that cost impact, you might be able to find some savings. Reusable sharps is a good point, or a good thing to point out as an example, because by purchasing reusable sharps, you're not having to deal with the waste costs of disposables. Packaging disposal cost is another one that needs to be included. Utility costs, I mean, with the gas prices the way they are, we're paying a lot more these days for energy and fuel and water. And so if you're buying a product, you should be able to examine whether it can be energy efficient, whether there are alternatives. And also, when you're purchasing a product, you should also look at what maintenance costs are involved. Any occupational health costs from handling that product, and environmental risk costs. Again, the mercury example, if you have a broken thermometer, you've got those costs to have to clean up. So really, all of these costs combined should be incorporated into your evaluation of products. Otherwise, money could potentially be going down the drain. Now, we've already talked about mercury and the fact that it is still in medical devices. Many hospitals around the country have become mercury-free, but essentially there's still products that still contain mercury. A lot of electronic equipment has mercury in it, so we encourage purchasers to have those products identified that have mercury in them, so when it comes to product disposal, they can be handled accordingly and handled safely. There are, in the boiler and air conditioning chemicals, tends to be mercury in those, and pressure gauges. So again, we'd want to make sure that in your purchasing specifications that you make sure that they label the products accordingly. PVC, as we've already talked about, is widely used in medical care. DEHP, I don't know if we really explained that. Do all of you know about DEHP? It is, in IV bags and in tubing. That is a softened product. PVC is generally hard. In order to soften it, they use phthalates. And one of the phthalates that is of greatest concern is DEHP, or diethylhexyl phthalate. And it is commonly used in IV bags and IV tubing and many others. But the issue is that DEHP is a developmental toxicant, and it does not stay in PVC, it leaches out. So a lot of hospitals are trying to find alternatives, and I don't know if this is new to you, but 80% of tubing DEHP is 80% in tubing, so it's contained about 80%, and 20% in something like an IV bag. And they have proven, FDA has proven that DEHP leaches from the tubing, but they're not willing to take any action. Manufacturers are making DEHP PVC-free products. However, as I think most purchasers already know, it's more expensive. Have you found that, Jerry?
Yeah, we're currently in the middle of, or just completed our negotiation with Hospira, who going forward is going to be our manufacturer for IV products, bags, solutions, and tubing sets. And this is where this discussion about moving to non-DEHP actually came into that discussion, where we went to the table asking for pricing for that particular product, and what we found was it's in that neighborhood of 10 to 20% higher than the current products we use now. But we were told by Hospira that if we can move a fairly large market share to this product, then we can actually drive the price down where it's more equitable with the current pricing. So I think that's the course that we're going to be taking.
Well, that's a positive response from a manufacturer. That's good to hear. The health effects of DEHP leaching is more pronounced with male babies and youth, because they're more at risk of developing reproductive system harm to their reproductive system. And there's also concern when people are hooked up to tubing for a long period of time, and the DEHP is, potentially leaching for long periods of time, and they may be more sensitive to it. So many hospitals are going away from DEHP containing devices, especially in NICU. And we have a list on our website. It may actually be on Healthcare Without Harm's website, but there's a new updated list of PVC DEHP-free products in all different categories, including catheters and many other products, and it has just gone on the website in the last week. In the Bay Area, many hospitals have already switched, and I know that probably your hospital has switched in some products. Some. Oh, okay. And Lucille Packard Hospital actually had a number of they saved over $200,000 by switching. I'm not sure how they were able to save, but they were able to save by switching to PVC and DEHP-free products in their NICU. Another area of concern for hospitals, a major area, is halogenated flame retardants. And I'm not going to get into a lot of the technical detail, but essentially halogenated flame retardants are just like dioxin and mercury. They do not break down into the system, they bioaccumulate, and there are a number of products that could have them in them. I won't say they do, but a number of products have to have flame retardants by law. So what purchasers want to do is encourage manufacturers or require manufacturers to disclose whether they've got halogenated flame retardants. And a lot of our documents that we provide purchasers do have that language in them. And any of these products that you see on the screen could be susceptible, and so you want to make sure that they are excluded. We could also modify specifications to ensure that manufacturers either are responsible for product or packaging take back, or encourage them to use reusable containers, but it's all going to happen up at the buying stage. There's also reuse and reprocessing, which can save healthcare a lot of money. I have one example here. I don't know where this one came from, so I can't attest to their cost analysis, but they went from reusable sharps instead of disposables. And when they looked at just the disposable price, they found that if you looked at just the purchase price of disposables and the reusable price of the service, it's more expensive. So if you just looked at that purchase price, it's not gonna show a savings to a healthcare organization. But if you looked at the other potential savings, they found that they could have an annual savings of $112,000 just based on the fact they will reduce their disposal costs, and they'll have labor savings and also potential OSHA injuries. Practice Green Health actually works with Healthcare Without Harm in the area of food. So that's not really our expertise. So I had a colleague of mine provide me some slides because Beth wanted to include it, and it's important to St. Patrick Hospital. So I was able to get some information for you. You know, our food system, you know, there's a lot of you know, use of antibiotics and other things that are like in meat or in cows, and a lot of interest in trying to get sustainable, organic, or locally based food that's antibiotic free, and also in the transportation sector of getting food from one place to another, reducing the transportation or the climate change, the climate impacts from that. So there are a lot of issues involved in examining which way to go with food purchasing. But the point is that it's important to consider. And there is a tool to help. Healthcare Without Harm has what's called a Healthy Food Pledge. And already 138 hospitals have signed up. And this is just simply to show vendors that you're interested in becoming, and you're interested in making sure that food is sustainably made. So I encourage you to look up this food pledge and to consider signing it. There are about 24 hospitals in the Pacific Northwest that have already signed on. I don't think there were any in Montana.
Now there are.
Now there are?
As of a few weeks ago.
Yay! Oh, so you already know about it.
What's that?
You already know about it. If you want more information on how you can go about making change in your food purchasers, the menu of change on their website, or their web address is listed at the bottom, is a resource that can provide guidance in a number of different directions to help you find more sustainable food. It shows you, you know, the resources on topics ranging from how to purchase sustainably produced chicken to starting a hospital-based farmer's market can also be found in that document. So I think that will be a valuable tool. So Kermit the Frog is here to tell you or ask you, is it really green? And if somebody says that they have a green product, you need to ask them, what exactly do they mean? Because what does green mean? It means that maybe there is one attribute, but you don't know what it is. They didn't tell you. So it's important to, come here, there, to look for specific environmental claims. And also perhaps to know more about the product so that you will know what is real and what is green and what is greenwashing. As well, even if they have one particular environmental attribute, you need to know that it may not mean that the product is green. The only example that we have for that, and I hate to even use this one because it's so bad, organic cigarettes is the only example. I think, you know, Waste Management, the garbage company, I don't know if you guys have Waste Management here, they used to tout that they spent millions on recycled content products. And lo and behold, all of them were their cars and their trucks, their fleet. And it was because of recycled content steel. All steel is recycled, you guys. So you don't have to ask if it's a recycled content product. Furniture is another good one. They'll say, oh, our product is 100% recycled content. Well, excuse me, how much of it is steel? Oh, all of it. So just be aware of that. It really doesn't matter. I know when I worked for Alameda County, we were wondering if we should ask, how much recycled content is bullets. It's like, that doesn't work. And then we've seen this, mercury-free IV bags. There is no mercury in IV bags. It's not a problem. I know you guys have seen non-toxic. There are a lot of products that promote themselves as non-toxic. Okay, well, everything is toxic in sufficient doses, even water. So that one is not a very good one that doesn't work. Also all natural, well, even mercury is all natural, so that one doesn't work either. So be on guard for all these types of greenwashing. There's a colleague of mine who works for Terra Choice named Scott Case, and he actually wrote The 6 Sins of Greenwashing. So if you want to learn more about greenwashing and the various examples, he's got a good publication on that. So it's important to look for claims that you can count on, because that way you don't have to write the specification yourself. You don't have to review the MSDS sheet. If the product is label on it that says it meets this certification, then you're saved. A lot of the work has been done for you. Energy Star is one of those. We all know it means energy efficient products. They've been around forever. Actually, I just got an email saying that they may not be up to snuff, so we'll have to see if if anything changes there. But anyway, Energy Star products will save money. So by specifying Energy Star, you're not gonna incur costs. ePeat computers have to have reduced toxic elements, have to have a take-back program, reduced packaging. There's 23 different environmental criteria, and it's tiered. They can reach the gold level or platinum status. So I would suggest that you compare what products you're using now and see if they are registered. There is no such thing as a label. You're not going to see an ePeat label like you do the Energy Star label. So just simply go to the ePeat website, which is popping up now, and you can confirm whether your products are on it. Now we've talked about e-waste and what to do with e-waste, and Beth has alluded to the fact that it can go in the wrong direction. And it has been. For years, a lot of our electronic waste has been shipped to developing countries. This is a photo taken in Nigeria. These boys are standing at a dump. They're burning the electronic waste to scavenge the metal because that's of value. These guys live right next door. And so all of this burning is releasing toxic elements to the air, and when it rains, it goes into their water. I mean, this is happening right now. I know one institution was identified, had their product identified on the hills of Asia. So you want to make sure that your products are not that are being recycled appropriately. And you can do that by, you can ask them to disclose where they're sending their electronic waste, or there's an option of using this pledge, the Electronic Recyclers Pledge of True Stewardship. And essentially this pledge means three things. One, they won't use prison labor to recycle the products. Two, they won't incinerate or landfill any of the materials. And three, they will not send it to developing countries. And four, they will track the disposition and provide you that information. A lot of people have asked, how can we impact greenhouse gas through purchasing? I don't have time to go over all of these, and I think we've already covered a number of them. We've covered ePeat, we've covered the cleaners. Durable, longer lasting speaks for itself. But buying local is, I just read that the city of Portland has a buy local day, and guess what day it's on? I cracked up. It's on Saturday after Thanksgiving, the biggest shopping day, and they're touting buy local in Portland. So that's another thing, maybe the town of Missoula, or the city of Missoula, to encourage people to buy local. And I know I don't think it happens in healthcare, but in local government, they do encourage to have a price preference for local commodities. So that's one thing you might consider. And I also want to point out, I don't have any slides here, but the EPA SmartWay Transport Program, it should say program, is a program that EPA developed for freight carriers and suppliers and shippers. And by signing up as a partner, they are saying that they're committed to reducing their greenhouse gas emissions and reducing their fuel use and finding alternative ways to ship products that saves energy. And there are a number of steps they can take. I read that they can reduce idling, or that the shipper will provide when they idle is because it's too hot outside and they want to keep their air conditioning going, or it's too cold and they want to keep the heat going. So they're providing stations for the truck drivers to sit in so they don't have to keep their trucks running and burning all that fuel. So this program works with the freight carriers and the shippers to encourage them to find ways for alternatives. So if you specify that your manufacturer needs to use EPA SmartWay partners, then that will have an impact. On our website is a 10-step guide to environmentally preferable purchasing, and it outlines, we've all talked about here, how important it is for management to buy in. I mean, you don't have to have it. I've worked with a number of organizations that simply went ahead and greened their contracts without management support, but it can only go so far. It's very helpful to have a policy to demonstrate that the support is there for your program, and I don't know if we have sample policies online, but I'll check on that. A team, I've heard several of you talk about you already have a volunteer team that you're working with. That's a great start because you've pulled people together to begin to tackle a number of these issues. I would suggest when you establish goals that you make them, I know Beth has done that with her work, that you make them time dependent and measurable. And here's some examples. That if you're going to reduce your mercury use, set a time period and how much you would like to see it to be reached. That way you can have some way to measure your results. Also, you want to make sure you designate responsibility. I don't know how many meetings you guys have been to where somebody says we need to do A, and you find out later that nobody was assigned responsibility for it, so it never gets done. So it's important to make sure that there is responsibility for each of the actions that you want to take. And you can prioritize your next steps. I really recommend working with your GPO. And I was in Tennessee at a group purchasing organization member meeting. Of all the facilities were there, and one guy stood up and said, "Why haven't you got an EPP policy?" And it just made everybody blush because the GPO didn't have a policy, and they realized they really needed one. So that's one example of how a member organization can really influence a GPO. So I'd encourage you to keep communicating and work with your GPO to ensure that I know Novation has a number of products, so if they don't, I would suggest that you work with them. Our website has a number of specifications. We're adding to it. Because we changed our name, our website is really being upgraded. So feel free to check back if you're looking for specifications that might be available online. I know we have a list of bisphenol A baby bottles. We have suggestions for electronics, what language you can use for them. I'd also suggest working with your current vendors. EPA worked with their office supplier several years ago to ask them to identify what all the attributes were on their office supplies. And the office supplier hemmed and hawed, and finally they did it. And now that office supplier is happily marketing this tool that they have, that they've identified all their products, and their environmental attributes. So it's important to work with your vendors. And that's essentially what the gist is of this slide. Because your vendors and your suppliers can really help you achieve the goals that you're trying to reach. And it may be that they already have information for you. I know when it comes to reducing paper towel use, which was a big deal when I worked for Alameda County, especially in the hospitals, the vendors had all the information on how you can reduce your paper waste. Many facilities, this is just an example of what some facilities have done to reduce mercury. They've set a policy and they've worked with their device suppliers to restrict mercury-containing items. And then the last 3 steps were to expand on what you've accomplished. And I know Beth is already doing that. She's going on how many years now working in this program. And communicate your success and celebrate. And I hope that for the members of Practice Green Health, you will apply for an award. It's an annual program that we have that recognizes the efforts of healthcare, of group purchasing organizations and businesses that have been leading the way. And last year there were over 100 organizations that were recognized and received awards. I just wanted to point out the resources that are available to you. The federal government, as I mentioned earlier, has been involved in this area for a long time, so they have a number of resources on their website. There's also a listserv. There's the Practice Green Health listserv that you can join whether you're a member or not, and that listserv is a great way to communicate with others in the healthcare profession and share ideas. The information is also archived, so if you're looking for information that it may be in the archive. For food-related assistance, Healthcare Without Harm has all their information on their website, and here are the contacts if any of you need them. I can give them to you later. But to reiterate, Practice Green Health offers a number of resources. This is not a sales pitch. There's also, we have over a dozen webinars every year, training programs, and I've left some fact sheets out on the table for you to consider, and if you have any questions, feel free to let me know, and thank you for having me here today.
Thank you.
Well, my topic is planning for environmental sustainability. And it's probably not the most riveting topic, but in fact, in order to move things forward, you have to have a plan and you have to figure out how to get the organization to take on your plan and move forward with it. And so for us, really after a number of years of trying kind of grassroots efforts to move environmental sustainability forward here, we figured out that the only way for us to really have an impact was to get environmental sustainability as an item in the hospital strategic plan. And that was because as we kind of looked at what we had been trying to do and why and how we weren't successful, we realized that even with great and noble intentions on the part of the managers to try and do environmentally friendly work in their own areas, all the managers really get their marching orders from the strategic plan and from what the hospital has decided are its key strategic priorities. And so even if they had good personal intentions, when push came to shove and decisions had to be made about how to use time and resources, they had managers have to respond to what has been laid out for them in the strategic plan, and that's what performance is evaluated on. And so environmental sustainability was not part of the strategic plan, and that was kind of where we were falling short. As an example of how we were not successful, we tried, as was mentioned earlier, for a number of years just to get plastic bottle recycling in the cafeteria, because that seemed like an obvious and reasonably easy thing to do. So eventually we got this kind of tacky looking trash can, and someone wrote on it with black marker plastic bottle recycling or whatever we wrote on it. And we had a couple of very committed volunteers who were picking up the plastic bottles and taking them for recycling pickup. And that went on for a while, and then eventually the recycling pickup kind of fell apart. And eventually we found out that the plastic bottles that were going into the recycling trash can were ending up in our regular trash. And so it just fell apart. And the reason for that is that there really was no accountability. No one was really looking at it as part of what the hospital ought to be doing. So our grassroots effort was not sustainable, and it was really frustrating. So we looked at how could we get traction for environmental sustainability here, and how could we get the support and involvement of employees and physicians, because that's what we really had to do to get going. So for us, we figured out that there were basically 4 keys. One was that we needed to get senior leadership interest and commitment to what we were doing. We needed to connect with something that's important to the organization. Environmental sustainability may be important individually and personally, but we had to somehow get people to realize that it was also important to us, important to the organization. We did that by including, or we didn't do that, but the next step was to get it included in the strategic plan, and then to use what we know here is our standard planning process, which it's kind of rote and it's kind of routine, but it is what allows us to move things forward and to keep some kind of forward momentum and to look at where we've been and where we want to go. So how did we begin? In the fall of last year, a small group of us were meeting to try to figure out how to continue trying to figure out how to get some environmentally positive changes here at St. Pat's. And just coincidentally, at the same time, our CEO attended a meeting with his peer CEOs, and at that meeting there was a discussion about the huge negative impact of healthcare on the environment. And at that meeting, the CEOs all committed to going back to their organizations and using the Green Guide for Healthcare Audit to look at their current practices and to get a baseline for where they were, and then to move forward by doing a gap analysis. So he brought back that commitment, and we undertook the gap analysis, or the audit rather, here. And by doing that, senior leaders and the departmental managers who were involved in doing that audit kind of got more interested in environmental sustainability and in the impact of our practices on the environment. And at the same time, in the fall of 2007, we were in the process of defining our strategic initiatives for 2008. And so because I was involved in both processes, I was able to help facilitate crafting, articulating a strategic priority for environmental sustainability that would go into our strategic plan. And going to this issue of connecting to what's important to the organization, we were able to very easily connect environmental sustainability to one of our 5 core values. And this is something that Mary Ann mentioned at the start of our conversation here. And so again, to it's our core values for us. It might be something different for other organizations, but to kind of make the effort sustainable, it has to connect to something that's important to the organization, rather than just being kind of a grassroots thing. And so we connected our thoughts to this core value and came up with a specific priority that is in our strategic plan, along with all our other priorities about quality of health care and patient satisfaction and financial targets. And so what we have in our strategic plan is that we want to develop and implement a plan that minimizes the environmental impacts inherent in providing health care and proactively work to provide a healthy environment. And so that kind of became the center point around which we could build our activities. The first step that we set out in this planning process, once we had a strategic priority, and of course that had to be vetted with senior management, and they had to agree that it made sense and it went into the plan. So our first step with that was to develop guiding principles. And the reason we did that was because we had to figure out what we meant by the strategic priority, and it gave us a platform for creating an action plan of specific tactics for how we were going to do environmental sustainability at St. Pat's. So we had these 3 guiding principles, which it's kind of lofty language, but it gave us the opportunity to, again, articulate what we meant. We defined what we thought were the actions that would allow us to carry out these principles, and these are some of the basic kind of themes of environmental sustainability. So reducing waste, process toxicity, looking at sustainable facility design, when we had that opportunity, reducing greenhouse gas emissions, supporting ecologically sound food systems, and then of course continuing to learn and expand our efforts. And then finally, the third piece of this was to make these statements that we would proactively and consistently consider how to be environmentally sustainable when we made decisions about things, processes, purchases, what have you. And so while we're always trying to optimize patient and employee safety, to also think about minimizing environmental impacts and to think about how what we buy and how we use it impacts the environment, and the kind of overall statement of thinking about how to protect the planet while we're trying to provide health care. So, with these guiding principles as our foundation, we then took the results of the Green Guide for Healthcare Audit and used that and just our basic knowledge to come up with a draft action plan that addressed key areas like waste, toxins, purchasing, recycling, energy, employee education, and engaging employees. We took the action plan, which basically Beth and I came up with, and we are not operators, we're not in charge of all the departments that have to do this work. And so we took the action plan and we went to the managers who are responsible for environmental services and facilities and purchasing and so forth, and went over the action plan with them to make sure it made sense and that we weren't imposing our ridiculous fantasies on their day-to-day work. And in addition to making the plan make sense and making it real, it also actually they had ideas that we wouldn't necessarily have thought of, and it also, of course, helped get them engaged in the process, which was essential. And in addition, it gave us an opportunity to learn about many more things than we knew were going on that were already happening here with regard to environmental sustainability. So it kind of increased our knowledge base, and kind of as a sideline gave us information that we have then used to apply for awards, as well as to continue to build on the efforts of environmental sustainability. One of the kind of basic planning principles is that when you create an action step or a tactic, you figure out how you're going to measure your success and who's responsible and when you want to get it done by. So that's not rocket science. It's just, it's what we do with all of our strategic planning, and that would allow anyone to move forward and know to know when you've gotten to where you wanted to be, and if you didn't, where you fell short, and also to know who's holding the ball on the issue, so that when things are not moving forward, there is accountability there. And that has just simply helped us keep kind of a forward momentum. We're hoping that our environmental sustainability efforts, that we'll be able to go to senior leadership and show them all the money we've saved and all those real tangible, quantifiable improvements. But we've told them that that may not be the case. Everything we do is not going to save money. Some things are going to cost money up front. They may save money in the end, but we're not real good at quantifying those kind of downstream savings. And so what we've talked about, in addition to hoping to save money and save resources in a way that we can actually see, is that there are intangible benefits. And for us, as a nonprofit organization that's very concerned about social accountability and social responsibility, it gives us another opportunity to work on social responsibility issues in a way that we may not have done before. And it also, at least for some physicians and employees, has given us a different way to engage us in working here and feeling good about working here, and feeling good about what the hospital as an organization is doing. So at this point, we have a small green team of 4 people. It includes Beth, it includes Marianne Sladich-Lance, who was here at the beginning and will be back in a bit. Beth is kind of the main implementer and mover forward of things, and Marianne is a VP, so she's part of senior management, and that's been real important for us because it facilitates decision making. We don't have to kind of come up with an idea and then go find someone that we can ask. And so as part of the planning process, having someone who has that decision-making ability sitting there in the room as you're coming up with ideas to either tell you it's a bad idea and it's not going to work, or more likely for us to help us figure out how to make it work and how to move it forward, has been real important. The other real advantage is that Marianne has a budget, and so we don't have a big budget for environmental sustainability work, but we have some, and when there is a need for money, we have someone right there who we can talk with about what's the reality of being able to get some money to do one thing or another. So that's been real important for us. Going forward, this grassroots group manages the overall effort and basically takes responsibility for saying what next, for keeping the process organized, for continuing to meet with the managers periodically, monthly or quarterly, whenever it makes sense. But we have ongoing forward meetings set up going forward. We take minutes. We have assign who's responsible for what and by when are they supposed to do it. So that's just part of the basic planning process that keeps things going forward. So just to summarize, what are some of the lessons that we've learned or things that we've employed to move environmental sustainability forward here from kind of the planning point of view is the most essential thing is leadership, interest, and commitment. Beth has probably been working on environmental sustainability issues here for, 10 years, long time. And until this last year, we've really had very little traction because we didn't have the interest and commitment in a real substantial way of senior leadership. Whatever their personal interest might have been, it was not out there as part of what we ought to be thinking about. Secondly, well, and I guess I'll go back and say the other thing that we have kind of learned, or at least that I've learned, is that different pieces of environmental sustainability are of more or less interest to different people. I think we're all appalled at the impact of healthcare on the environment, and that certainly was our CEO's message when he came back from this meeting. But in subsequent meetings, and when we were reviewing the guiding principles with our senior leadership, and we're talking about doing a little education in the process, one of the things that got some of the people's interest was the impact of toxins on waterways and fish. And for the fly fishermen in the group, that was like a big deal. And that, you got to hang your hat on something, and that was something that was meaningful. Other people found other issues to be more compelling. So it's the old thing of tailoring the message to strike the interest and kind of strike people at their core to get them engaged. We've somewhat stayed away from talking about, at least in meetings, and trying to kind of create plans about carbon footprint and global warming, which can be more or less controversial depending on who you're talking to. So poison trout are pretty safe, and to some degree we haven't focused quite as much on kind of the big picture, but have more looked at just healthcare is doing bad things to the environment. That's bad for us in a lot of different ways, and we need to address it. Secondly, just connecting with something that's integral to the organization. For us, it was our core value of stewardship. Might be something different elsewhere, but that has kind of just allowed things to come full circle for us, so that it made sense to include environmental sustainability in our strategic plan. It connected back, as do our other priorities, to our core values and to our mission. And because of that, it will be we'll be able to keep it at the forefront along with those other strategic priorities. For us, having the ongoing and active involvement of a senior leader has been real important for the reasons that I mentioned. Decision-making, some budget authority has been real important. And then just to continue to employ our standard planning process, which for us, once we created the strategic priority, included developing those guiding principles as a platform for action. We got those approved by our senior leadership, so they knew what we were talking about. And that was real important to have senior leadership be real clear about a topic which we hadn't talked about a lot here, so there wasn't a lot of kind of mystery and confusion around it. To do an audit and a gap analysis, and use that gap analysis to create an action plan, so that your action plan was based on some knowledge, some baseline information. And in that action plan, to have measurable success indicators so that you know when you've been successful and when you haven't, and to involve managers and assign accountability for each of the actions. And then to just, for us, it's a dynamic process. The action plan changes every time we sit down to review it. Either something has happened, or we get a new idea, or there's a need for an adjustment. So that the action plan in itself is dynamic, as well as trying to keep the topic alive with education, with updates, with events such as this, and just to kind of keep it in the forefront of people's minds without getting tedious, to find new ways and ongoing ways to keep people interested. So that has been the strategic planning process here, and I'd be happy to hear your comments or answer any questions if you have any.
You know, finance is a big discussion, I guess, anywhere you go, right? It's certainly a big part of everything we think about in the hospital. It's not the thing that we work for particularly, it's not what we're here for, but we are dependent on healthy finances. Bifocals, I can't see you. And so some of the things that I've learned this year in looking more about this is just trying to wrap my arms around how can we think about finances clearly, how can we consider savings and costs in efforts towards sustainability, or really any mission-driven effort, and have a conversation that is not just a dead end. Because that seems to often be the case, that it's like, nope, we don't have the money for that, sorry, because the money is the biggest deal. Now, I don't believe that's the case. I've seen many things happen here at St. Pat's and in other mission-driven organizations that don't demonstrate that behavior. But nonetheless, it has caused me to do a lot of thinking about this. And I just want you to know I'm a nurse, not a financial expert. I have done some studying and done some interviewing and some talking, but that's why this talk is called Thinking About the Green and Green. So I would just like us together to talk about this and think about it. I have some slides to go over and some ideas to share, but I'm looking for answers. So one angle that I'm going to talk about is just what is the money involved in green to an extent. And then the next part is about how might hospitals or organizations track their green spending. And then finally, what are some ways to think more broadly about a whole picture of health of an organization that's not just financial. So first of all, we've done a lot of talking today about a number of these items. So LEED building, you know, as Richard went over so clearly and convincingly, that it's a no-brainer when you look at the long-term costs. And of course, with energy prices going up, it only makes sense to build the best envelope that you can, because in future years, those energy costs are going to be more. Energy, similarly, almost the same discussion, but not exactly. A couple of examples from here that relate cost savings to energy are our groundwater cooling system. That was put in 91, actually, and we pump water out of the ground and run it through the air conditioning coils on top and then pump it back into the ground. Pump it out at 48 degrees, back in at 60. And so that's what cools our building. So we were told early on that costs about 10% of what it would have cost before, what it did cost before in terms of energy. That may be an exaggeration, I've been told. But anyway, let's say it's 50%. That means that over the past 17 years, we've saved half each year of what we would have, we could, in other words, double our costs for air conditioning. So again, it's a no-brainer. That one's pretty easy to see because you can measure the before and after, more or less. Another one that we have coming up is the HIVACs that you mentioned, Richard. We have this vacuum pump system. For our hospital, it will cost us $23,000 to convert, and it will be paid off in 2 years. So we save $11,000 a year basically going forward. So those sorts of things that you can see, you know, make for an easier argument, easier tracking, really. Water, that same example, save $11,000 a year. So there are good reasons to work for. I think we've covered most of these. Waste management and recycling, through some of those examples I gave this morning, clearly can save money. Toxin reduction, mostly through risk reduction. And if you have a spill or a problem, then you regret that you might not have spent the money before. Commuter support. This is an interesting one for whoever brought up parking. Just because we were told in our building analysis that for on-the-ground parking, it cost about $25,000 per parking spot to build for over 40 years, is what I'm recalling. Underground was more like $35,000. So if you start to support commuter behavior and start to actually think maybe you could get by with fewer parking places and then justify that in terms of a cost analysis. Now, it's going to be a hard argument to make because we're going to keep driving probably. But as things change, hopefully culturally, with higher gas prices, maybe people will actually drive less. Maybe we'll have more public transportation, that sort of thing. So that's a good thing to anticipate so that you don't pave your entire world and pay for it because it's expensive. So I justified, therefore, putting money toward commuter programs. And then just as we've talked about all day, as you go through and look at all the things you can in analyzing the efficiencies, it drives down wasted time, wasted money, wasted resources. Okay, so how do we track finances at this point? Not everybody, but how we do it here and how some other places I've talked to do primarily keep track of budgets based on the department. So it's, you know, the facilities has a budget, mission leadership has a budget, nursing has a budget, and there's a lot of overlap and whatnot, but it's done that way. It makes sense, it's logical, it's manageable, you know. The costs are tracked by purchase and expense. There's line items, you can look them up. Revenues are tracked primarily by income. So how do we track the savings? It's a little bit more complicated. We can do it in advance by projecting what we will save with a given project. We can do it retrospectively by looking back and saying, okay, how much energy did we save or how much waste did we cut? But it's not necessarily part of ongoing tracking because it's like photographs, looking forward or looking back, rather than a dynamic running total. So if we have an organization-wide initiative, for instance, quality. I always think quality, infection control, and sustainability could be thought of similarly. Quality and sustainability especially because they're both house-wide. It's hard to put it in one cost center. Involves everybody. Is not real product-driven. Infection control is a little bit more product-driven. Initiatives like that are kind of hard to track because they're everywhere. You know, our quality has a staff, some staff people. You could track their expenses, but you can't track the effect on our oncology unit necessarily financially or in surgery. You know what I mean? Similarly with sustainability. Things that are directly attributable to sustainability, you could charge out of a cost center that way, yet it doesn't really measure financially what's happening throughout the whole organization. So I would like myself during this work to have a bottom line. You know, I'm driven to have a bottom line. I want to know how much it costs, how much it saves. Therefore, we can make our case better. But it's not so easy to do. That's what I'm learning. Or you can get an idea about your initiative focused on a project. So for instance, recycling. What did it cost us to put the bins out? How much does it cost us per month for pickups? What are we saving in garbage, not putting it in the landfill? But then you still can't, according to this, measure what's it doing for our staff, and what's it doing for our marketing, and what's it doing for our PR. Okay, so what if you did something different and you developed a sustainability cost center? This is what some places do. And then the finances are all tracked through there. So, you know, in an extreme situation, you could say, well, anything related to sustainability is going to come out of a cost center. So let's say we have one, and we want to do this $23,000 vacuum deal for the water savings. We could say that it's going to be paid for out of the sustainability cost center. But then that gets confusing because it's really an operational function. So, okay, should that really be a sustainability thing? And then at the same time, we save that $11,000 a year forever. Do we get to count $11,000 a year forever in the sustainability budget? Yeah. That wouldn't go over so well. So that doesn't exactly work either. Yet it gets us a little bit closer to managing some of the costs that we'd like to, that we will incur with this initiative that we're serious about. Okay, so challenges to that are what I just said. So things that happen in an operational center, you know, don't make sense so much to leave in a sustainability cost center. Also, like I said, we can't keep hold of those savings year after year. It becomes more of an analysis and an academic statement, really, if it's not a piece of the operating budget that you end up with cash. So that's why I say savings are vaporous. But I don't want to forget them. And just like I said before, I write these things down, but then I just talk, you can tell. Okay, so what if you did it this way? You had your same budget that we all started with in our columns, our silos, but we had some way of identifying sustainability features with an S or something. And so therefore, operations was going to spend $23,000 to put the vacuum systems right, and so that one would get flagged. That way, at least we could go back through and query sustainability-related costs so that at the end of the year we could say, what did we spend? And still, we don't have an answer for savings. We could just say, okay, then thinking back on those expenses, what did we think we'd save, and can we tell now what we did save? Not all financial systems are equipped to do this. I mean, this would require basically some programming for us to do this. So break in at any time, especially Richard and Jerry, who know a lot more about this than I do. What seems difficult about some of these too is easier in places and areas in the hospital that are clear-cut. So energy is fairly clear-cut, it seems like, because you have kilowatt hours that you're paying X amount for. You have gallons of water, X amount for. More difficult in areas like inspiration, or even like nursing operations. We know what we spend on things, we don't know what we spend on the time. You know, it's harder to analyze the nursing time related to sorting the waste properly or recycling and those sorts of things. So, okay, so another idea, a traditional hybrid. So this is what as I understand it, how I talked with Kaya Belkis at Boulder Community Hospital in Boulder, because they've had a healthy sustainability program for about 10 years. And just to say, okay, how do you do this? And I also talked with our CFO about some of these ideas, and we kind of came up with this would be about a fairly close way to do it. So finances remain in their relevant cost centers. So operations is operations, nursing is nursing, mission leadership is mission leadership. But all that are related to sustainability are tracked, but outside of the financial software and the financial system. So seems duplicative in some ways, probably more work in some ways. Well, not really, because you'd have to rebuild your financial system. Probably, maybe the best way we have to do it right now, at least here. So you don't actually, get credit for the 23,000 saved. Yet you do report to the people who are making decisions about it that through our sustainability efforts we've saved X amount of dollars. So what Kai had said about their hospital is he was able to track about $600,000 savings through the various projects that they've done, and I don't know over what time span that is, but I think it's somewhere around 5 years. And at least if we're kind of keeping track overall, being able to report in a logical and reasonable way that has a sustainability report attached to it and has messages back to leadership, that's a start. So why do we want to track finances? Well, everything we've talked about. We'd like to have a realistic cost. We'd like to be able to, from my perspective, I want that because I'm convinced that these measures save money, basically. They don't all save money. Some of them require money, but I believe overall the effort, including the driving of efficiency, saves money. So if we don't have the proof of that, we can't really tell that story. Then, if we can justify that, we can shift some of the costs, especially if it's in the same budget cycle. And if we're saving money through waste segregation, we can spend some of that money on the nursing education that's required to achieve it, things like that. It's easier to just keep track as a habit of all the activities that are happening and what the cost and savings is at the end. And then your sustainability report is just about written as well. From the organizations I've seen with sustainability reports, it's just impressive to see stuff written in one place. As we've been collecting, part of one reason I've been talking with our directors to see if they like our plan. No, see if our plan is reasonable or the plan is reasonable. We also have said, tell us everything you're doing. And it's been fascinating to just learn, because I would have no idea some of the things we're doing in purchasing versus food and nutrition, and we have quite a list. And so to begin to track these in an organized way, some of them are affixed with or related to finances and some aren't, but it gets you ready to go. And so it's a good habit. It's the other end of the planning. It's the tracking of the results. And especially with leadership, I think numbers talk. And not just leadership, but it's an important picture of our financial health and our organizational health, and we have to be able to analyze it. All right. However, for the health of an organization, it's not only finance. So I've been interested in this broader discussion about what else we do, because it does seem sometimes like the main thing that we worry about is money. But we already track very clearly our community benefit. And other organizations that are mission driven, that's a feature that we have to defend our tax status. And there are years of history of doing that. We do that very well. And so we are already looking at both financial and community benefit as bottom lines for us. Anytime we do anything that helps the community, that in terms of environmental stuff, it resonates pretty well. I think it's true that green is so hip right now, but Missoula has been a hotbed of environmental activism for 50 years, 40 years. And so it's not just because it's popular right now, it's because, as I read a report from the power company, actually, they, in their research of why people like to live here, like 77% or somewhere in the high 70s, their top 1 or 2 reasons was the environment. So it's healthy, it's clean, it's good for kids. People, we gravitate toward it. And so it's important for an organization to be able to embrace that and share it as well. And I don't think that's greenwashing. Employee satisfaction, as we've said before, that can be a real indicator. I would love to be able to to do the financial analysis on nurse retention and what it costs to bring new nurses in or physicians if we can't find them. And is there an element of this sort of behavior that relates to that in a quantifiable way? I don't think it's worth the time to try and quantify every little thing we do, but I'd like to have some, reasonable understanding of that, because I believe that is true. Again, operational efficiencies, which we've talked about a bit. So how do we make decisions based on all those things so that it's not just the financial bottom line? Richard talked about this, and so did Beth, but if life cycle cost analysis came from the energy sector originally. It's been around, from what I can tell, 30 or 40 years. It's looking at long-term life of things and processes. And so I would like to apply that more broadly in the hospital, both to purchasing and, again, to our decisions, because it will give us a better picture of true cost. If we always are looking at just the price tag, like Beth pointed out, we won't know where we are. So certainly it includes disposal. I'll go into a little more of this. And you may find out that the first cost is quite a bit different. So what all is included? First cost, maintenance cost, training costs, replacement costs, disposal costs. So those are all quantifiable dollar amounts. We can predict, we can inquire, we can ask our purchasing groups, etc., and we can analyze that. So what about these? These are the ones I'm always wanting to get after. So worker safety, that one we can probably research to an extent. Worker satisfaction, I was talking with Tim Hagler when recently I talked with him. He's he's higher up in purchasing. What's that?
He's my boss.
Okay, and asking about how do you bring those sorts of factors into a decision about purchasing? And he explained that you trial things out, you have a lot of people interview, you try them in different places, etc. Efficiencies based on frustration. Okay, so you get a product, you think it's great, and then pretty soon, every time you walk by, you trip on the wheel or something. And so it's just this thing that drives people nuts. How do you know that before and or work it into a decision that would reflect this true cost? Breakdown, that one is probably fairly predictable. I was thinking of ergonomics and steps required, so the hardship of an object on the body. And also value measures. So how do we bring all this together? Is it what we want to be doing environmentally? Is it what we want to be doing in terms of social justice? Are we helping support businesses? Other organizational values that may not be related to those things. How do you start to bring that all into a more global picture of both cost and of organizational health? So as we do it now, we basically look at the financial bottom line. We do have a community benefit report. We do have a growing sustainability report. But really it's the financial bottom line. So I would like to broaden that. As I spoke with Bruce Whitfield, he seemed like he too would like to broaden that. There are some options. Triple bottom line reporting and accounting you may have heard about, but it's basically to look at finance, social justice, or social entities and environmental impacts. And so are there ways to do this that make sense? Sort of. I haven't found it exactly. What does it look like? What we do right now in our in our annual reports is a financial piece and a mission piece. So that's community benefit. And many organizations, many hospitals are mission driven and have that same feature. It's required, basically. And so that could be seen as double bottom line reporting. Conservation economy, I'll show you a slide about that helps to clarify some of it. Challenges of this is typically the financial report is in numbers, the community benefit report is in words, and the sustainability report is in words. It doesn't have to be. I'll show you an example that isn't. But it's difficult still to come up with an overall picture unless you just hold the balance in your idea of organizational health. Common language is lacking. It's not all numbers, it's not all US dollars, it's not all the same ideas about what should be important. So these are some of the challenges, and yet I see to somehow have the full picture like this in a bottom line is really powerful. So other ways that people think about this in the past are corporate sustainability reporting, corporate responsibility reporting, a balanced scorecard, which may or may not. The balanced scorecard is not typically have an environmental element, but it could. It typically has customer satisfaction, finance, efficiencies, but other features and factors than just finance. And then triple capital is a look at natural, social, and financial capital. So this is just an example. This is the economy section, the financial page of a triple bottom line report from Noranda in 2002. And so it's just as you would think as a bottom line financial page. Society. So this was worker safety stuff, local employees or not, quality of their service in terms of Six Sigma, charitable donations, etc. So these were quantifiable. They made them into numbers. The things that they chose had a numerical descriptor. And then environment. So how much have they recycled? What were their pollutant emissions, energy consumption, etc. So for them, that was quantifiable as well. Toyota has an interesting report if you want to look at that. And actually all the car companies surprisingly have pretty good reports out there, sustainability reports, not so much triple bottom line. Either way, I think that it's really, really helpful if an organization is ready to share its sustainability truth with the public. This is another approach, and it's not exactly a reporting tool, but it's just to describe. If we had these three areas, natural, economic, and social, again, and this is a helpful website if you want to look at it. All these buttons light up and stuff, and it's full of lots of information. It's not a template that we could use to figure out how we want to do our tracking and reporting, but I think it helps to start to move us toward a fuller description of where we are. Again, what I just said before, the act of collecting the data at all helps get us started. It helps us tell a fuller story about the organization. It helps us report it to people who want to know, and I do believe people want to know more. It's a good habit, as I said before, to just get us ready to track for the upcoming year, and it helps us set a bar each year so that we know where we are. It's just, again, a good habit. This Global Reporting Initiative is an interesting organization. It's out of Denmark, and they have over 1,000 companies who report through them. They have some fairly specific guidelines, quite specific. It's a very detailed website and very detailed reporting, but it's kind of interesting. These are just some sustainability reports that I thought were worth looking at. Catholic Healthcare West does an excellent job of listing the many, many things they do and quantifying some of them and describing some of them. The Balanced Scorecard Institute is also interesting. And then this last slide I showed you was from this conservationeconomy.net. So, I do think that green initiatives can save money. I mean, I think if we were only to take Richard's example of St. Pete's and $700,000 in energy savings over however many years that was, you know, I mean, it's clear. Energy, you could say that energy is sheer operations, but we know that that's a big piece of sustainability work. Not only because of resource, but because of climate change. So that one speaks for itself. So it's hard to, I think, figure out how to do some of this tracking. It's not real obvious. I mean, our organizations are so complicated, and all the different things that we track or don't track very well already are challenging. Tracking itself can be kind of self-defeating. I mean, how much tracking is reasonable, you know? But we do need some sort of way to measure our progress and set realistic goals. I think that starting to look at this bears fruit right away, but especially over time when you can make comparisons from year to year and from area to area of what you're working on. And it's always instructive because we learn as we go. And then communicating this is really important. It's important internally because that's how we tell a story, that's how we point out to people that we're making progress, that's how we show ourselves that we're making progress. And then it's important for healthcare. I mean, I think just having a meeting like this, I think having Practice Green Health be what they are, I think having healthcare take the lead in many ways in terms of organizational environmental work. And as we've been shown, we need to. We're one of, as an industry, one of the biggest polluters, really. And so being able to talk with each other about it, to share reports, to compare numbers in a common language, I think is a really important goal. And I think it's pretty hard. So, questions, comments, solutions?